Mute your phone in the meantime.
Good afternoon, everyone. I have a little bit of feedback there, I see. Okay, thank you. Thank you and welcome to the Black Health Trust weekly program. We know that you could have been anywhere else right now and we're so pleased that you've decided to empower yourselves by joining us today. It's great to have our regular attendees back and those new to joining us. My name is Michelle and I'm your hostess for today. I hope you're all doing well from wherever you're joining us from. Today, our panel will be moderated by the distinguished Dr. Randall Maxey, Chief Medical Officer of Advanced Community Medical Care Corporation and President and co-founder of the Black Health Trust. He will introduce his wonderful co-moderator and guest today. Black Health Trust was founded as a result of the global pandemic and Dr. Maxey's desire to keep his own family safe. And lucky for us, it's evolved into a vision much larger than expected. The purpose and mission of the Black Health Trust is to provide credible insights from our community of health experts to best serve our communities of color with a coalition of leading and longstanding Black medical professionals across a diverse spectrum of disciplines to offer unvarnished opinions and insights into our physical and mental health during these very challenging times. These opinions are offered to help educate and inspire you to take your health seriously and to ask questions of your own medical practitioner. I'll share a few housekeeping items and announcements for the program. One, please be advised that the video conference is live and being recorded on different public platforms such as Facebook Live and YouTube. Your participation on this program is completely voluntary, and if you choose to participate and prefer not to have your image and likeness displayed, please kindly use your video and audio settings on your personal device, and you can use that to block your picture and mute your voice. That said, all participants will be muted initially by our Zoom technician. We ask that you remain muted until the host or moderator asks you to contribute in order to minimize the distraction of background noise so we can give 100% attention to our speakers. So please just double check and make sure your device is muted. With regards to the chat room, if you have questions, which we hope you do, you can enter them into the chat room, but please limit your questions to 2 questions per topic being addressed, and please do not use this forum to advertise or promote your own personal products. Understand we'll get to as many questions as we can, but there always isn't time to get to every single question. I'd like to read a disclaimer now. Please note that the information communicated on this program is not intended or deemed to be medical or legal advice, and you should always consult your own medical or legal professional for advice and direction pertaining to your particular situation and needs. The information presented here is not advice, but rather opinions and recommendations from credible sources. Black Health Trust, its representatives, members, heirs, assigns, and guest speakers assume no liability whatsoever in connection with the information presented or used by anyone, nor are these discussions directed to specific situations. Again, we strongly encourage all attendees of the program to consult their own legal and medical professional for conclusive guidance on how to proceed in your own personal circumstances. We are in this together. If this program has been valuable or is valuable to you and interesting to you, please visit the website to learn more about our programming and how you can support Black Health Trust so we can continue bringing our community outstanding programming. Visit www.blackhealthtrust.org. That's blackhealthtrust.org. So we want to thank the Black Health Trust Steering Committee, the Executive Board, the virtual assistant, our production and Zoom technician, and all the people behind the scenes for their time and efforts that make this programming possible. Let's now welcome all of our distinguished physicians and special guests. We thank you for sharing your valuable time, information, and educated insights with us today. Your participation and support help empower our communities of color, and this is critical for our present and future well-being as a people. Knowledge is power. Let us also take a moment to recognize the birthday of Dr. Martin Luther King, whose vision of a world that works for everyone inspired and keeps inspiring us as a nation to do better and be better humans. Tomorrow we celebrate this ordinary man who did extraordinary work for humanity in his short time with us. So thank you, Dr. King. Welcome everyone again to the Black Health Trust Weekly Program. This is our community. This is our time to improve our health. Dr. Maxey, would you please do us the honor starting the program?
Thank you very much, Michelle, and we appreciate you doing such a good job every broadcast, and thank you so much. Ladies and gentlemen, we have a very special day today. Instead of giving lectures per se, we want to address many of the questions and concerns that our listening audience has expressed over time regarding health disparities, specifically regarding COVID-19, and especially about the issue of vaccines. It's very important that we discuss these to the best of our ability in an advisory capacity. I'd like for Dr. Neighbor-Stevens to give the introductions of the CVs or biographies of our speakers. And then I want to give a little information before we start the questions. Dr. Neighbor-Stevens.
Thank you, Dr. Maxey, and good afternoon, everyone. We are so happy that you have chosen to join us today. We have a panel of experts who are available to answer questions, and all three of our panelists today have been with us before. So to our regular viewers, they are not strangers. But to our new viewers, let me introduce our panel. Our first panelist that I will introduce is Dr. Jordan Despain. Dr. Despain is an entrepreneur and medical communicator driven by the challenge of addressing complex problems through biotechnology. After obtaining his Bachelor of Science in Biology from Louisiana State University, where he actually conducted research on coronaviruses, Dr. Despain investigated the molecular biology of cystic fibrosis at Johns Hopkins Hospital. He later earned a pharmaceutical sciences degree at the University of Southern California for his dissertation work developing chemotherapy drug carriers to combat triple-negative breast cancer, an aggressive disease primarily affecting young Black women. The next panelist that I would like to represent or introduce to those new to our program is Dr. Natalie Janine Daly Garnes. Dr. Garnes graduated from Princeton University with a degree in molecular biology and earned her medical degree from Harvard Medical School. She is trained in internal medicine and pediatrics and currently practices infectious diseases in Houston, Texas. Our third panelist is again an old friend to BHT, and he is none other than Dr. Wilbert Jordan. Dr. Jordan is the medical director of the Oasis Clinic at King Drew Medical Center. Dr. Jordan has committed himself to HIV/AIDS research and prevention since the early 1980s. He has been involved with the AIDS epidemic from its recognition, and in 1983 reported the first heterosexual case of HIV in Los Angeles County. Dr. Jordan was part of the NIH FDA National Medical Association Committee that formulated the design of the NIH-sponsored DATRI or DATRI study on low-dose oral alpha interferon, which was used in treatment of HIV. He has served on the Los Angeles County HIV Planning Council and the Prevention and Planning Committee since their inceptions. He has also been the medical director of the Minority AIDS Project since its creation and chaired the Black Los Angeles AIDS Consortium for the past 12 years. He has been on the board of directors of the AIDS Research Alliance for several years. His areas of research have included genotyping to confirm drug resistance to antiretroviral therapy, comparing antiretroviral viral activity and tolerability of different treatment regimens, and focused interventions for identifying new HIV positive clients through active patients. So without further ado, I would like for us to launch off into our program today. And I'd like to start by asking Dr. Garnes if she would address the question.
Can I first give the statistics for today?
Oh, absolutely. I'm sorry. I'm so eager to get to these questions. Go right ahead.
Simon, can you show the first slides, please? I go back to November the 22nd, where the total cases in the United States were 11,843,493, with over 93,811 new cases at that time. And the total deaths on a daily basis was 253,500. We come now to the 17th of January in 2021, where the total cases are now at 23,653,919, with the number of total deaths standing at 394,495. The new deaths in the past 24 hours total 3,557 people. And there have been some days in the past several weeks where that has topped 4,000 a day. Just for context, that exceeds on a daily basis the amount of people who died in 9/11. And we were also disturbed about that. The other thing that I want to call your attention to that is a part of public health, and especially the health of communities of color, is that we recently had an assault on the US Capitol by white supremacists. And there has been information that not only have they been assaulting the government of the United States, threatened the inauguration of the new president and new vice president, but there has also been information that threatens state houses in all 50 states. Now, in that milieu, we do know that if white races have sway and law enforcement does not enforce the law against white racists the same way it does against the so-called members or affiliates of Black Lives Matter, that we are all at risk. And I urge each of us and their family, our young people, to exercise appropriate social caution when traveling the streets, when going out. Be aware of your surroundings and be careful. There's more to this than meets the eye. There's been willful neglect, and I'm sure that there are people of bad intent. Now, there are people of good intent too, but be very careful. That's part of our job, to provide you with credible information that you should protect yourself at all times, especially young people being out. Us young people, I'm talking to my colleagues now who are 18 and 22 years old like I am. We must be careful. Even though we want to have a socially good time, we should be careful going to bars, going to parks, and if you're going camping, and make sure that you're appropriately armed, make sure you're not alone, make sure you have a group with you, and people are self-aware. That's my word to the wise. I'm very excited about the questions that we're going to attempt to answer. I invite you to put questions into the chat box. Please limit your questions to 2 questions or so to our panel members. And I would encourage you not to put information in there about personal products or sales or opinions. That would be very important. And I also urge you to understand that even though we're health practitioners, we're not permitted to give medical information specific to you while we're on the line. Even though we think it's credible, things are changing day to day. And each of the opinions expressed by our panel members are considered personal opinions and not direct information for you to act on. You must go to your own private physician or practitioner for help. With that, Dr. Neighbor Stevens, would you start the questions? And Michelle, you can too, and let's move forward.
Dr. Stevens, you are muted. There you go.
Yeah. Thank you, Dr. Maxey. We're going to start the questions off around the subject of the vaccinations, not just the vaccine, but actually the vaccinations. And so I'd like to start by asking Dr. Garnes if she would comment on the side effects that may be experienced post-vaccination. Are there any potential downsides or negative effects in taking the COVID-19 vaccine?
Can I respond to that?
Go ahead.
Yes, while she's getting off, go ahead, Dr. Jordan.
Yeah, I had the initial round of the, it was two series of 30% supposed versus the 70%. And I had no problems first 2.5 weeks. I was scheduled to have my second injection the last Friday. And I noticed I was feeling different. My staff noticed that I was shaky. So I decided to wait till this coming Tuesday. And it was important for me to be able to say, no, this is not COVID. But I did feel I was having some side effects to the vaccine, which again is not unusual. Mass numbers, people can have some side effects. I cannot get COVID from taking the vaccine. I could be exposed to COVID still. And I think that's the part that people have a hard time understanding. You can't get COVID from taking the vaccine. You're only given a small particle of something. So you can't really get it from that. It doesn't prevent you from also being exposed to that. But my staff, Lord, they freaked out. It was like, I'm not dying, please. I mean, it was a weird, it was a weird experience. I mean, my nurses, I mean, whom I love dearly, my God kids whom I love dearly, they were ready to create World War V. I'm not dying. I can get up. I can go to the bathroom. I can fix my dinner. I mean, it was like, and each one was spreading rumors. He's shaking. He's not doing things. He can't go to the, and am I saying something different from you all? But we just worried. Guess what? I'm the one who got the shot. So if you go worry, follow me. Don't try to lead in terms of that, okay?
Thank you, Dr. Jordan.
I think it was just people were not quite ready to deal with that at a personal level, someone they knew.
And that is exactly why we wanted to bring this topic up today. Dr. Garnes.
So thank you very much, Dr. Jordan, for sharing your personal experience. So in answer to your question, Dr. Neighbor Stevens, yes, there are adverse effects associated with the vaccine. There are ones that are more common. So the most common ones that people tend to report are especially fatigue, muscle aches, definitely pain at the site of injection. And a lot of people have reported that that pain is more severe than they've experienced with the flu shot in the past. And generally, these symptoms will last 24 to 48 hours, particularly after receiving the first injection. After the second injection, people tend to have more significant side effects along the same lines. And the degree of those side effects do seem to be somewhat related to age, with younger persons having more significant side effects, such as being more likely to experience fever, for example. Generally, most people have reported significant muscle aches to the point that they weren't necessarily sure they wanted to get out of bed that day, significant fatigue, and in some cases, those symptoms are lasting a little longer after the second shot, more like 48 to 72 hours in some cases. But for the most part, they are short-lived. Obviously, all individuals are different, and so some people can have some other side effects. The most severe side effects that you may have heard about, there are certainly people who may have anaphylaxis or severe allergic reactions to the vaccine. Usually those occur within 15 to 30 minutes after getting the vaccination. Some people can experience symptoms further along after that. And for that reason, it's recommended to avoid the vaccination if you have a history of allergy to any of the ingredients of the vaccine, or to consider discussing it with your care provider if you have problems with anaphylaxis to any injected medications in the past.
Thank you, Dr. Garnes.
I'd like to respond to that too. Dr. Jordan and I are in the same general age group. He's probably a lot older than me, but we're in the same age group. I too had the vaccine approximately a week and a half ago. And I'll tell you, I'm deathly afraid of needles. But I didn't even know I had the injection. I had no soreness of my arm, not one symptom at all. And so each of us may have a different interaction. I had the entire medical staff and support staff at my office, and nobody had any side effects or any problems with that. And we're all intending to get our second injection this coming week.
Good.
So I'd like to address the next question to Dr. Despain. I know that you gave a very thorough explanation about how the vaccines and the mutants work, but we're still getting questions, so we need to revisit first the question, can you get COVID from the vaccine? And if not, why not? And then a corollary question to that that has come in related to this is, do the mutants that are being identified in any way change the way the vaccines protect or interact with the mutants different from the strain that we originally were dealing with?
Thank you for that question, Dr. David Stevens. So first off, I'll begin by saying that the mRNA vaccines, vaccine candidates from both Pfizer and Moderna, they don't cause the infection, right? It only consists of what's called the liposome, which is basically like a fat droplet that actually houses the messenger RNA. It kind of acts like a cookbook of sorts, so that once it gets into the body and goes intracellular into your cell, immediately it can go to what's called the ribosome, which is basically your body's manufacturing system, and start producing a ersatz version of the spike protein. So basically your own synthetic version of spike protein that then goes to the, the plasma membrane of your cell for recognition by your immune system, which consists of B cells and T cells. So basically what's happening whenever you see a lot of these reactions and people are feeling bad and whatnot, and the fact that it's happening more so in younger people is because they actually are having a vigorous response of their immune system to this spike protein. So there's that aspect. And then with regard to the second aspect, what we are seeing right now is that we're encountering quite a few mutations that I have spoken on beforehand. Before in the summer, it was D614G. And then now we're hearing about like N501Y. And most recently, there is E484K. So the problem with these mutations is that this is an example of evolution, like in real time, acting in real time. Basically, what's happening is that as the virus is infecting more people, because it's based off of an RNA genome, RNA is very error prone. So that's a part of the virus's actual strategy in order to, I guess, evolve to surmount any obstacles that it comes into contact with. Like, okay, you have a vaccine against this original strain, but I can just evolve these other mutations. So thus far, the vaccine companies have actually run studies and deduced that their vaccine candidates still remain efficacious against the D614G as well as the N501Y mutations. But what we're seeing is that there is risk that this new, the new E484, the E484 mutation, which I believe goes into glutamic acid. I'm blanking right now, but that third mutation actually has a risk with it that most of the antibody treatments that are have actually been FDA approved are no longer working against that specific, I guess, variant under investigation. So we do have to be mindful that what's happening is that as time goes on, the virus is gaining these point mutations when if there are more that happen over time, which again, that's fairly a given, we'll need to have more vaccines that need to be updated. So.
Let me ask you a couple of clarifying questions.
Of course.
When you get the vaccine, are you being given the virus itself?
Absolutely not. No, you're not. No, you're being given like, so basically like I'm from Louisiana and we're Creoles, and like one thing that's always important is to have like the cookbook to the best, jambalaya. So like just look at it as, instead of like being able to take your mom's cookbook, like instead, like let's say I just took I guess a scrap where I recorded like how her jambalaya is made, and then I just ran with it, and that's basically how the mRNA acts. So basically, it's like a template to make the spike protein so that your body can immediately recognize it.
Okay, and then the second question, the side effects that some people feel are a result of a successful immunization process and not related to the actual COVID-19 disease. Is that correct?
That is correct. Although I will clarify that the fact of the matter is that it's not that you get the vaccine and then it just, you're magically like protected within like, 3 hours and whatnot. The both Pfizer and Moderna have been very assiduous about stating that the vaccine doesn't begin to impart protection until at least 12 to 14 days after the administration of the vaccines in question. And that's after the second dose, keep in mind. So this talk, especially in the United Kingdom, about, oh, we're just gonna give only the first injection and then hope for the best. That's not gonna do anything, right? You really need to receive both doses. The reason why is because that first dose acts as a beacon, like, hey, I'm here, but then you need to receive the second dose to build out that like long-term immunity.
Is it not true that you get some immunity, up to 55% immunity after the first dose? There's not that degree?
You will get it, but it will be short-lived. The reason why is because you have your B cells and your T cells, and those need to work in tandem. And if they only see a threat once, they'll kind of get lazy and stop working. So that's why you need to get that booster shot in order to maintain it. Otherwise, your immunity will probably drop like a stone after
very quickly.
I have one other question. How do you spell assiduous?
Assiduous is ASSIDUOUS.
Just like it sounds.
Yeah.
Dr. Jordan, you had a comment or a brief comment before?
You're aging yourself. When you went to school, they didn't use the word assiduous.
Dr. Neighbor Stevens?
Yeah, Dr. Despain, I want to push one other thought your way
Yeah.
because it's beginning to come up in the chat box. And it was actually one of the questions we were going to address in a bit. And that is, after you get the vaccine, can you still get COVID?
Yes, yeah. So it takes time for you to actually build up for your immune system, rather, to build up a response. So I actually was checking the news this morning, and it turns out that there actually was Tel Aviv's chief rabbi, I think his name is Landau and whatnot, and he actually received both both shots from Pfizer, and he still got infected. And he's an 83-year-old guy. So one thing that a person needs to also be cognizant of is, like, just because the vaccines are 95% efficacious, that still means that there's a 5% chance that you probably will not get any protection. So that mathematically speaking, that comes out to 1 in 20 individuals, even after vaccine, they might not be protected. And then you also have to factor in that, again, it takes time for your immune system to build up that recognition. So you could still be a sitting duck. So you still need to enact the same, precautions of wearing a mask, staying indoors, et cetera, et cetera. So it's all agglomerative. It's not, you can't do one and stop doing the other things.
I think it's important also, and I want Dr. Garnes to weigh in on this, that we need to be clear, and I don't think it has been particularly clear, what the effectiveness of the vaccine is. What is it effective in doing? And that is part of that answer to the question I just asked Dr. Despain. So Dr. Garnes, would you please speak to what protection the vaccines give? And there's been a question that has come in. What is the risk benefit breakdown between actually allowing yourself to become infected with the virus versus the advantage or disadvantage of receiving the vaccine?
Thank you, Dr. Stevens. I was going to comment because one of the things that we have to keep in mind when we discuss the vaccine studies is that when the studies were designed, the goal was to prevent disease. It was not to prevent infection. And so we know that these vaccines are 95% effective at preventing symptoms from disease. We don't know what the efficacy is at this point on preventing infection. So that's the main point that I want to make in answer to the first question. With regard to the second question, I think we have to really think about the answer to that question is going to depend on what other comorbid conditions you have to some extent. So if you have some of the comorbid conditions such as obesity, diabetes, hypertension, that we know confer an increased risk for severe COVID-19, resulting in hospitalization, increased risk for ICU stay, and increased risk of death, your risk to benefit ratio is going to be very different. Now, for someone who is younger, you don't necessarily have as much evidence that it's as worth it to get the vaccine. However, we know there are still a lot of young people that are dying from this disease. And the other thing that we have to take into account is that even the people who are surviving, some of whom have had very mild courses of the initial infection, are having long-term effects in terms of fatigue, in terms of ongoing damage to the lungs, ongoing damage to other organs, which we don't fully understand yet. And so from my perspective, the risk to benefit is much more in favor of getting the vaccine, where you may have short-term side effects that in many cases you can manage with Tylenol or ibuprofen versus long-term effects that are completely unpredictable.
Let me just speak to that a minute. One of my patients, who's the head nurse at a very large local hospital, she runs the emergency room. She did test positive for COVID, got severely ill, was treated, hospitalized, sent home. And then a couple of weeks later, was found down in her home. Paramedics took her back. Turned out she has severe pulmonary fibrosis. She's had some mental syndromes, and she was so worried that she wasn't going to get paid from her job. She wanted to know if she could work part-time. I said, you need to decide if you're going to live, let them pay you, be off, forget the job, because this is deadly. And so I support the fact that our task force looking at vaccines thought that the overall recommendation of the Black Health Trust was to support the use of vaccines, because the long haul syndrome can be permanent. And that's especially bad if you're a young person. This lady is like 42 years old, and she is essentially in bad shape. So there are risks. We know there are side effects, but the side effects of the disease versus the vaccine seem to be not on the same footing. Maybe Michelle, you see something in the chat box before we?
I'll start with one of our earlier questions, and I hope that it hasn't been covered in some way, but it's directed at Doctors Garnes and Despain. In lay terms, please explain what would be a good strategy for testing with targeted vaccination.
So I'm not entirely sure I fully understand the question, but what I would say is in terms of our testing strategy, I wouldn't recommend changing that at this point for the exact reason that we don't know that the vaccine prevents infection. So if someone were to attend an event and then find out, for example, that someone was positive for COVID after attending that event, I would still recommend that you get tested after that, because you could still have been infected, and we don't know that the vaccine prevents you from infecting other people. So you would still need to quarantine, you would still need to do all of the same things that you would have done before having the vaccine. On the other hand, in terms of testing, the vaccine does not change the testing at all. The antibodies that you make to the vaccine do not in any way affect the PCR test or the other tests that look for acute infection, such as the antigen testing and that sort of thing.
Could you explain just practically the difference in those two tests, what they are, so everybody will know what they are?
So there's several tests that are in development. The PCR test, I think, is the one that most people consider to be the most reliable, which is actually taking the viral RNA and actually amplifying that and measuring how much viral RNA is present within whatever sample was taken.
How was that test taken?
So that usually, the classic is the brain tickle, so the nasopharyngeal test, but we're finding that even if you do, as long as you get some sort of nasal sample, so it can be the back of the nose, the middle of the nose, the front of the nose, combined with an oral sample. Oral samples alone do not seem to be as accurate. So those testing of those secretions, and then that sample is taken and they look for the viral RNA and amplify that. Nucleic acid testing is very similar. And then you have antigen testing, which is looking for pieces of the virus.
Okay, so one is the nasal swab and the other is the finger prick or blood test.
So the finger prick of blood test is generally when you're more, they can do it for antigen testing, but also for antibody testing, which is looking more for infection at least 10 days or so or more.
Okay, thank you. Dr. Neighbor?
Thank you. So there's been a question in the chat box around the issue of who should and should not get the vaccine. Are there individuals who have comorbid conditions that, I don't guess you could call pregnancy a comorbid condition, but are there comorbid conditions that would make you not a candidate to receive the vaccine? And what about whether or not you've already sustained the infection? Would it still be appropriate for you to receive the vaccine?
I actually spoke to individual in the chat earlier in a private session, and basically the question was pertaining to if the person had a history of allergies and whatnot, would it be wise to get the vaccine? And what I responded to that is that according to United States National Vaccine Database, anaphylactic reactions occurred at a rate of 1.31 per 1 million doses of vaccines administered out of a total of 25 million doses in the United States. And 85% of those occurred in individuals with a prior history of allergies. To that end, I would advise that a person always consults with their primary care provider prior to getting a vaccine, regardless of if it's the influenza or coronavirus. And secondly, if you do have that history of anaphylaxis, then ensure that you're in a hospital setting such that if anaphylaxis does occur, you'll have medical personnel on hand to administer epinephrine as a precaution. And just to clarify, the influenza virus, the influenza virus vaccine can actually still pass on, you can still transmit the virus even after you've gotten the vaccine. So it's kind of very similar to what we know about the SARS coronavirus vaccine, namely that it will prevent you from developing the disease, but we still don't really know whether this will permit transmission to other people, even though you yourself are protected. So an abundance of caution on all fronts.
Any other comments on that from the panel?
Let me just follow up on that. There was a part of the question about the comorbid condition that you mentioned of pregnancy. Should a pregnant person get the vaccine? Any of our panelists?
So I guess to both comments, in terms of comorbid conditions that are contraindications to getting the vaccine, I agree with Dr. Despain. The known contraindication right now to getting the vaccine is if you have a known allergy to one of the ingredients. Everything else, it kind of depends. So in answer to the question about pregnancy, so what we know is that pregnant women and breastfeeding women were not included in the studies. So we don't have data in that population. However, we know that they are at increased risk of death. We've had several reports in the general media of babies being born to women who are COVID positive, and those women don't survive to take care of their children. So for that reason, the large organizations, ACOG, for example, are recommending pregnant and breastfeeding women fall within that 1B category. So the recommendation is for vaccination of that population. In terms of other comorbid conditions, we know that persons, for example, with autoimmune disease that are on active treatment, like active immunosuppressive therapy, patients with cancer that are not history of cancer, but active cancer on therapy, again, we're not included in the studies. So we don't have data. The recommendation is if you fall into any of these categories, for you to talk to your healthcare provider and weigh the risk to benefits.
Do you have
to me, that is the most important thing that we tend
Go ahead, Dr. Jordan.
omit. The most important thing for us to be recommending to any woman who is pregnant, thinking about getting pregnant, that category, they should be encouraged to see their primary physician. If there are women out there who do not have a primary physician, there is no excuse, particularly in LA County. They should be being required. Our goal should be getting those persons, encouraging them to go see someone, period. There's no reason for any woman in this county, in this city, to be 5 months pregnant, 9 months pregnant, and not being seen by a doctor. That just makes no sense. And we still have that. But I think that's where we need to really be focusing on, period. It really makes no sense for us to see women being brought into emergency rooms in labor and they'll have the doctor.
So what you're saying is prenatal care is extremely important.
Prenatal care is extremely important here. And for us in this county, I can't think of a reason for someone not to have prenatal care. We see it. And we see it again at King nearly at least once a week. But that shouldn't happen. Now, it's one thing if you're out in Raleigh on Pam Dam or whatever, some rural place, but it makes no sense here. Rural Mississippi, maybe, but it makes no sense here. We should be really recommending have someone with prenatal care. That's That's just, for me, very frustrating when I see someone. I'm not the primary when I see it, but it just makes me so damn mad that you're living here in LA and your priorities are such that
Dr. Jordan,
you're not going to deal with the baby.
let me,
We've already said the child is going to have some problems.
Dr. Jordan, let me ask you a quick follow-up question. You treat a lot of patients with HIV, and some of them are on antivirals. Are you recommending that people on treatment for HIV and related diseases receive the vaccine? And what have you seen in that? Just short, brief answer to that.
Yes, we have been testing all of our patients, period, and we've already tested about 1,500 to see. What has been interesting, about 11% initially tested positive, but only 5 patients had the disease. They were totally asymptomatic, and many of them totally freaked out when we told them, you test positive. Interesting, when we retested, half of them had lost their immunity. Now, this is where me and the county come in, because some were saying, well, maybe the test was wrong or something. It looks like, from what we're looking at our HIV positive patients, many are not maintaining an antibody level, which is why I think it's important to get people vaccinated. So I think that's still a lot that we don't know about this,
So
period.
you're asking them to make sure they get vaccinated too, is that correct?
Yes,
Okay.
all of our patients get vaccinated.
Dr. Neighbor-Stephen?
I want to ask Dr. Carnes to address the last part of the 3-part question I gave you, and that is, what is the recommendation regarding taking the vaccines if you actually have recovered from a COVID infection?
Thank you for the reminder. So as of right now, there is no contraindication that we know of taking the vaccine if you have a history of COVID infection. Although, again, as I mentioned before, these patients were specifically, if they had a known COVID infection, they were excluded from the studies. There were some patients who they went back and did antibody testing on and found that some of them were positive, and they are doing sub-analyses of those patients. In terms of, I know some people have talked about, maybe you wait if you have, you've had a recent infection, maybe you wait until your immunity supposedly has waned. We don't have any data supporting or refuting that strategy right now, but I would not consider that a contraindication to receiving the vaccine.
Thank you.
May I
Dr.
raise a question?
Despain. Go ahead, Dr.
Raise a question, and this is maybe going back to the 101. Even after you receive the vaccine, do I understand correctly that we should maintain the same protocols of social distancing when in groups, of wearing masks, and also being cleanly in terms of our hands? And I would like a brief practical discussion, probably from Dr. Garnes, of wearing a mask and the precautions you take with it, clean it, put it on and off, or Dr. Neighbor-Stephen. We spoke about that earlier, but I'm extremely concerned that people might think that as much as we recommend vaccines, it is not a magic bullet to cure everything.
So with regard, this goes back to what I was saying before, to remind you, we don't know that the vaccine prevents you from giving the infection to other people. So therefore, yes, you need to continue everything that you were doing now until we get more information. So wearing a mask, making sure that mask covers your nose and your mouth at all times, because it doesn't work as well if it doesn't. In terms of care of the mask itself, so if you're wearing a reusable mask, cloth mask, it's better to have one that has at least 2 layers. You can wash it. I would recommend hand washing it with soap and water and allowing it to air dry. You should change your mask every day. When you go out in public wearing your mask, think about the fact that the outside of that mask is contaminated with what you're getting from outside. So I would avoid as much as possible. We see a lot of people adjusting their masks. Whatever's on that mask is then getting on your hands. And then if you touch the rest of your face, you're putting yourself at risk for infecting yourself. So those are some of the things that I would keep in mind in terms of mask care.
Okay, I've heard of people taking a mask and putting it in a microwave for 60 seconds on high. Does that work?
Say that again.
You can clean a mask, I'm told, by putting it in a microwave 60 seconds on high, or in the oven for 30 minutes on 350. Provided, of course, that if you do a microwave, it can't be the N95 that has a metal strip in it. I like what she said about using the wash by hand, but it can also be done in a washing machine. But the caution, I understand, taken out of the washing machine, it needs to go into a clean bag or clean box and not just dropped in other stuff that may be contaminated. So that's very good information. Go ahead, Dr. Neighbor Stevens and Michelle.
Well, Dr. Despain or Dr. Jordan, would you comment on why? I know we've gone through this before, but there's a question in the chat box, and I think we should address it. Why is it the new vaccines that are in the pipeline now only require 1 dose versus the 2 that are out requiring 2 doses?
So actually most of the vaccine candidates, with the exception of Johnson & Johnson's, require 2 doses, again, for the same reason that first injection is just to kind of send out a signal for your immune system. Again, those B cells and those T cells to say, here I am, guys, here I am, guys. And then afterwards, once you receive the booster shot, that, builds up that ostensibly long-lasting immunity. But with regards to Johnson & Johnson's vaccine candidate, they're going about it in a different way. They're still using the spike protein as the antigen or immunogen of interest, but instead what they're doing is they're not using this like lipid or fat particle that contains messenger RNA. Instead, what they're doing is they're using an adenovirus. So an adenovirus is basically a common cold virus that has actually been genetically modified such that it can actually really infect you, or what we call transduction in the laboratory. And then that will actually allow your body to express the spike protein, and then your body will recognize it. And the reason why that can be 1 dose is because you typically see 90% transduction efficacy rates with viruses, because viruses have been honed by millions and millions of years of evolution to infect the cells that they target. Whereas when you're using a liposomal carrier, like what Pfizer and Moderna are using, that's something that was just engineered by humans. So, you'd be lucky if you get about 30 to 50% transduction into cells. But again, the data is in the pudding, wherein it is 95%. Both of them are roughly 95% efficacious. So it's just a different methodology or strategy. And yeah, Johnson & Johnson seems to have pioneered, the adenovirus with just, one shot. But to the best of my knowledge, they are still only in phase 3. They haven't really reported any results yet.
Any other comments to that before we move on?
I would just argue that people should take one or the other, doesn't matter. There's no reason to not take it. And I think too much of the discussion is still trying to focus on why not avoiding it. The choice either we take it and increase the chance of living, or if you look at the data, you see the hospitals here are unbelievably crowded. We're in a position we've never been in before. I mean, you can't even, some of the emergency rooms, some of the hospitals have taken over the dining room, other places, the gift shops, to expand, to have patients there. Many elective surgeries, other things they don't want to have at this point. We've never seen that before. And I think what we can hopefully all do is get our community to take one or the other. So hopefully they don't come down with this, period. And it's not fun and games. And when you see people being brought in to emergency rooms, and now for the first time, if I stand in front of St. Francis of Centinela and you see someone coming in a cold, you have no assurance that they're going to be able to treat the patient. I mean, we've never had that in this country, let alone in Los Angeles County. That to me is scary. And I don't want to make sure that we encourage everybody they can to get vaccinated. This is not, Randall, we argue back and forth on who was the oldest and who was the ugliest. It really doesn't matter. But now when you look at AIDS, and I saw the first case here in LA County of heterosexual AIDS. I've been doing it from the very beginning. And we can look at a lot of this and see a lot of what we have missed. After 40 years, we still see patients coming in to Oasis. Why are you having unprotected sex? We have medicines that no one cares whether you heterosexual, homosexual, old, young, doesn't matter. But there is no reason. And the last two patients, I simply asked, can I close the door and talk? And I looked at the young man and said, if I was your dad, I'd whip the hell out of you right now. There's no reason for you to have gotten HIV. You were negative 3 months ago. Why? And it's sort of the same thing we're looking at with this. There are just some things we know better, and we should be emphasizing and moving on, rather than having to continue to tell you to do these things. I mean,
let me say,
if I have a young man like Dr. Despain coming off his, I don't want to beat the shit out of him, be very honest. Why would you go out and have unprotected sex now?
Yeah.
Let me say this.
I think we have to deal with the protective part that we can all offer.
Dr. Jordan, your points were extremely well taken. Let me just take a moment to salute who you are. Dr. Jordan, and the reason I'm going to say you're older than me, you interviewed me for my internship. You're at Beth Israel in Harvard University years ago. I was a little intern to be, and you interviewed me, and I appreciate that. But he's one of our best known infectious disease specialists, has been in the vineyard taking care of people for a long time, and we certainly appreciate you. Now, I know that I was talking to various hospital-related doctors in the past week, and most of our hospitals, St. Francis, Centinela, they have these big white refrigerator trucks in the parking lot. Guess what that is for? They are refrigerating the dead bodies that have resulted from COVID. So if anybody thinks this is a hoax, they don't know what they're talking about. There's such an increased rate. The ICUs are full. They're making ICUs. So that's something that we're trying to get people to protect themselves against. Michelle, are there any things in the chat box?
Yes, and I think it's worth addressing the worst case scenario, the questions that have come in with regard to that. So Norway has recently reported the death of 23 frail elderly patients within 2 weeks following the Pfizer vaccine. They are suggesting the vaccine risks be evaluated for frail elderly patients above 80 years of age. Pfizer/biotech are investigating. Any comments there? And there's a second part from Dr. Sherrod. VAERS is the agency where adverse events to the vaccine are reported. As of December 13th, deaths related to COVID had been reported. Please comment on the circumstances of these unfortunate reactions.
That sounds like a question first, and Dr. Despain.
So I don't think we, these are early reports. I don't think we have all of the information yet, unfortunately. We know that these seem to have been elderly persons. They seem to have a lot of, again, they were frail with underlying conditions. There was some report as to whether the known side effects related to the vaccine, fever, diarrhea, may have contributed to the death. So, there is a concern that it was directly related to the vaccine itself, particularly in the cases in Norway. I think we're going to have to look into this more. And, again, these are the things that we're lacking when we do studies. These were huge studies with 30,000 people, but it was still a selected population. And unfortunately, we can't get all of the information that we need from that selected population. This is why we have VAERS. This is why they developed the vSafe app, because this is going to be an ongoing learning process. And so this is important information for us to have and take a step back. And so, if you have patients that fall into this frail elderly category, you might want to wait on vaccinating those patients. Take into account what their risk to benefit is. If they're in a long-term care facility, it may be a little different than if they're at home. And we have to kind of see and keep our eye on the additional information that we get on this.
Thank you.
Thank you, Dr. Grimes.
I was wondering if Dr. Walks, who is the chair of the Black Health Trust Vaccine Task Force, would like to make any comments before we move kind of into a COVID Basics 101.2 part of the program. Dr. Walks?
Simon, he would be the 301 or 202 prefix.
While we're waiting, I wonder if anyone wants to jump in on should a kidney transplant patient get the vaccine? What are the risks? Is there a quick answer to that, or quick insight on that? Should a kidney transplant patient get the vaccine, and what are the risks?
So I commented on this briefly in the chat. This kind of goes back to what I was saying about patients with autoimmune disease, same category. So in what I mean is that these are patients that are on immunosuppressive therapy and therefore would not have been included in the vaccine studies. The reason they weren't included in the studies was because there was concern as to whether they were going to respond to the vaccine. And so there is a possibility that a person falling in that category may not have as a robust an immune response as somebody who's not on immunosuppressive therapy. We don't know what the effectiveness of the vaccine would be for that person. But again, we have to look at the risk to benefit. There have been reports of people having worsening kidney disease after having COVID. And so it's, again, I would go to your healthcare provider and discuss the risk to benefit.
As a nephrologist, and recognizing that these people are immunocompromised, even before they get a renal transplant, the regular dialysis patient with end-stage renal disease is already immunocompromised. We wipe out the immune system in order to keep the kidney from rejecting. So my initial advice, generically, not applied to a specific person, is they should be vaccinated as well. And in fact, dialysis centers are now immunizing some of their patient bases. We're doing that here in the US. We're doing it in Puerto Rico, which is also US. So I do, in the general case, recommend that those populations be vaccinated as well. Even though they weren't in the trial, there was a cogent example given to me. If you know that the vaccine may help you, but you're not sure of the side effects, and you're given a jar of 60 M&Ms, and you know absolutely one of them is going to kill you, which one are you going to take? So there's a choice to be made, but I'm encouraging people to go on the side of having possible protection. But we know that even taking an aspirin has risk. Drinking a glass of water has risk. And if you ever want to scare yourself, read the package insert of some of the medications that you take, even for a glass of water. Dr. Neighbor-Stevens?
We're still trying to get Dr. Walks unmuted. So while Simon is working on that, I'd like for us to transition, as I said before, back to basics. Sometimes I think people are more receptive to recommendations when they really understand why the recommendation has been made. Clearly, there is a significant part of the population who is resisting the basic public health recommendations that are being made that would have a dramatic impact on reducing the number of COVID cases that we are experiencing. So I thought it would be a good idea today to step back and understand why the recommendations were made and how they can help to decrease the rate of infection. We've talked a little bit about how to wear the mask and not to touch the mask, but and there are more comments that can be made around how to wear the mask. But let's talk a minute about why you want to wear a mask so that we understand when we would need to wear the mask, even in the home setting in certain situations. Dr. Carnes, you want to take that one?
And Dr. Walsh may be unmuted now too.
Okay.
Is Dr. Walks unmuted?
I am, yes.
Okay.
Okay, go ahead, Dr. Walks, and then Dr. Garnes will respond to the basics about masks.
Okay. One of the interesting things about masks is that there are differences in how effective masks are. So I think that a lot of times we will see folks with a very decorative mask, a very cute mask, and I think it's important to get something that is effective, and maybe you can wear something over the effective mask that is more decorative or has some sort of a message that you want to convey. I also think that with respect to wearing masks, we have to be very, very consistent about how important it is. Vaccine, no vaccine, the mask is really the protection that we have until we get to some point down the road where officially we are all in agreement that we have herd immunity, we don't have to worry about it. And I really think that is far from now. It's a separate conversation than all of the other things. The mask is important. It protects you, it protects other people, and we have to set that example and stop pulling it down when we're trying to talk. All the things that people think are okay. Well, let me just pull it down so you can hear me. No, I leave it up. I'm going to listen harder. So I just think it's important for us to be very consistent, very practical, and set a really clear and consistent example.
Thank you. I agree.
Thank you. Now, let's talk a little bit about social distancing, because clearly that's an idea that people are struggling with. Who would like to address the why we have the recommendation for social distancing? Dr. Despain, you want to take it or who?
Sure, yeah. And then afterwards, I'll pass over to Dr. Garnes as well, because I know she probably will have a great deal to say on the matter. At least approaching this from a virologist perspective, the reality is that the SARS coronavirus 2 is just looking for a warm body in which to use as a host before it, for lack of a better term, matures and gets into another host body. It's a body hopper, if you want to use a sci-fi term. So the reality is that you break the chain and you deny it that opportunity to body hop like some horrific sci-fi, thing. If you are actually like enacting these like social distancing rules, like, okay, it's wonderful and whatnot for you to want to go hang out and party with friends and whatnot, but you're basically like not only putting yourself at risk, but potentially these like other people, right? Because being in close proximity is what the virus really needs, because the virus transmits via aerosols, right? So anything, like a breath of air or, like just anything really. And that actually is what allows it to like piggyback onto your like bodily fluids in that aerosol and then go out to the other person. And like, don't mistake it, right? Like you can actually shoot out biological projectiles fairly far. Like they even did a study to the best of my knowledge where a person can, when they're running, they can actually be behind like a 6-foot trail, even if they're on like just a jog. and whatnot. And I actually will be putting in a graphic in the in our Zoom group chat, so you can actually see what the size of the SARS coronavirus 2 is. It's approximately between 100 to 500 nanometers, which is very, very tiny. A nanometer basically is like 1 times 10 to the negative 9. So like even smaller
Compare it to a hair.
Yeah, exactly. Yeah, and exactly. You'll see in this image that I sent that a hair looks massive compared to it. So so you really need to know what you're up against. So this really ties both into like why you need to be socially distanced, because you're not gonna see a stream of virions coming at you. And then secondly, that also ties into why you want to wear a mask, because again, like those, again, the most effective are the N95 masks, and those can protect down to 300 nanometers, which is 0.3 microns. So again, like if you can see it, then it kind of helps you. So I just gave that to everyone. And now I'll pass it over to Dr. Lawrence.
Thank you, Dr. Despain. What I would add, so in terms of the why wear a mask, as we said, you know, the different masks are differentially effective, like those neck gaiters that people like to wear, particularly the sports folks. That's a single layer, it doesn't help. If anything, it might actually make things worse. There have been some studies that look like it might make it more likely for somebody to pass aerosols. So you have to be very careful about the type of mask that you're wearing. And the thing is, the mask is most effective if the person who is infected, who may not know that they are infected, is wearing it. That is when it protects the most. Yes, you are protected when you wear a mask and you're around someone who's infected who doesn't have one, but not as much. So it's really important that each of us takes responsibility for our neighbors and wear a mask so we can protect the ones around us, those that we love. In terms of the physical distancing, the best protection is the combination of a mask on the infected person, on the uninfected person, and the distancing. If you keep all of that together, the likelihood of you transmitting this virus is very low. And this is going to be especially important in light of this new variant that they're saying is even more contagious. So we have to be extra vigilant in this case to really make sure we are doing everything possible to keep the numbers down. There are too many people in the hospital right now. There are too many people dying. Yes, we are our brother's keeper. We have to do something about it.
Yep. One thing I actually want to also mention is like, at least according to the scientific data, it's not necessarily that only one like variant. And just so you guys know, a variant basically just is a viral particle. So it's not like one, it only takes like one variant to like initiate an infection. Based off of like the best scientific data that we were able to, you know, find and report in the literature, we see that it takes about 1,000 variants to cause a SARS coronavirus 2 infection. But again, it's not like you won't know, you know, when you're you know, in the presence of any aerosols containing SARS coronavirus 2. And 1,000 variants, as you can see from my my visual capitalist graphic that I sent, that can be very, 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 very small. And again, like our eyes, we can't see those small things. So just, you know, just always enact the supreme caution.
And the thing is that the more people you're around, the more likely that at least one of those people is infected. And so that's why, you know, the other side of the physical distancing is not just maintaining the physical distance, but also avoiding large gatherings, because the likelihood, and especially someone put in the chat about fomites or surfaces, you know, it seems to be mostly related to droplet and perhaps aerosol, but fomites do contribute. And again, you know, you're in a place where a whole lot of other people are touching stuff. The likelihood of somebody being infected and leaving that virus there is very high.
Yes, and actually, I want to, you know, like toggle off of what Dr. Garin said about fomites, and actually, this is part and parcel of why one should also use the like sodium hypochlorite, which is the chemical name for bleach, or even like the hand sanitizers containing at least 70% alcohol. The reason why is because the SARS coronavirus 2 belongs to the Coronaviridae family. So this is the family of viruses, and these coronaviruses, what they do as a part of continuing the body hopper analogy is that once they get out of someone else's cell, they steal part of that plasma membrane I mentioned before. They steal a part of your, like, what made your cell, and uses it to protect itself as an envelope. So what's interesting is that those envelope viruses are uniquely susceptible to detergents. So the detergents actually cause the virion structure to actually break apart, almost like a Lego, I guess, that you kicked over. So that's something that you don't encounter with non-enveloped viruses. Like adenovirus is far more hardy to detergents, whereas again, these envelope viruses like coronaviruses, which include SARS coronavirus 2, they are exquisitely weak against the detergent, just always be able to wipe those hands, etc. So it's a multi-pronged strategy that we're trying to emphasize here.
Thank you for that. I think that's very important.
So we have one other component of the public health recommendations that has been touched on around the fomites, but don't forget that just soap and water does a good job as well. And if nothing else, it has been eye-opening to me since the initiation of the pandemic that we have to go back and instruct people on washing their hands, such a very basic hygiene activity. But I want to now open up another area that is very popular on BHT, and that is the role of nutrition in helping you to withstand infection. And I'm going to throw the ball back to Dr. Maxey to open this part up.
Thank you very much, Dr. Nabhan-Stephens. We know that nutrition plays a very enhanced role in not getting the virus in the first place, of being healthy, of having a strong body, almost like wearing body armor, so to speak, by having a good, strong immune system. And we, on our early calls, we emphasize using micronutrients. And since many of us often don't get the micronutrients contained in leafy green vegetables, a plant-based diet, we tell people that they should probably use prenatal vitamins. Now, I'm not pregnant, at least I wasn't yesterday, but I use those prenatal vitamins because they contain all of those factors. Now, in medicine, we have two artificial branches of medicine. One is the so-called Western or allopathic doctors, and the other are doctors who call themselves functional doctors. I personally think there's no division between the two, but I think functional doctors do make some sense, and they say, let's stop you from getting the disease by making your body as strong as possible. That requires good nutrition. And we know that many of our population lives in food deserts. What you get at a Ralph's in the hood may not be the same thing you get at a gourmet shop in Beverly Hills. So that's very relevant. And what brought this to mind, I saw the name of Dr. Lisa Kervin-Dawes on, and she raised the point. She resides in Jamaica and the capital of Kingston. And she's one of the medical directors at Kingston Hospital. And she spoke that a lot of the food that they eat in Jamaica is organic and vegetarian. And she suggests that they may have a bit less in their population there. I'm wondering if she would speak on that just a moment. And I do want to ask several individuals about the role of nutrition, vitamin D, good eating, et cetera, like that. Dr. Lisa Kervin-Dawes, can you unmute yourself?
I think we do have this in Jamaica, and I think because we are a part of the climate and we've talked about that. But I think naturally.
We can't hear you. We have a microphone.
I'm actually driving, so that may be the problem. Okay. But in Jamaica, we actually do eat more fruits and vegetables. They are seasonal. We heat, so as we know, it dies on the surface quicker.
I don't think
of the reasons why it is hitting us as hard.
Dr. Dawes, if you get to a better place, maybe you can call back, but we can't consistently hear what you're saying.
Don't check for antibodies here that we don't know about.
But I
But
know you.
definitely, I think eating healthier with the micronutrients are important.
Okay.
We got that.
We just naturally have it. I mean, we eat and drink a lot of bush. I was just in the country, and some of my friends were talking about this bush they drink for that, and this bush they drink for this. And what's that bush you were telling me about that's good for corona? Gerber is telling me. I said, which study is that? They say, yeah, man, everybody that drink Gerber, none of them get sick yet.
Very good.
So I said I would look into that.
Okay. Well, thank you. I want a
Are
brief.
you hearing me? Because I'm driving.
Yes, we're hearing you, and thank you. I'm going to ask a question of another couple of colleagues, Dr. Michael Carter. In 1 minute, can you talk about how good nutrition can help us avoid COVID infection? Dr. Michael Carter?
I'm going through a bad section.
Okay. I don't hear Dr. Michael Carter. Dr. Sherrod, you want to comment on that briefly?
Thank you, Dr. Maxey. And again, I want to commend you on continuing to provide very important information to our community on this pandemic and on health in general. And when we started, I would talk about boosting up the immune system because there are three major factors that determine whether you get infected with the virus. And the first one is the status of your immune system. So we want to make our immune system strong, and we do that by nutrition, sleep, and exercise. Now, you can boost up your immune system naturally by eating correctly or eating a lot of high antioxidant foods like vegetables and fruits, but it's generally recommended, and these are just recommendations. They're not for you to, we're not prescribing, but in general, it's been documented, the data has been documented that vitamin D levels affects the severity of your infection if you get infected with COVID-19. That data has been documented. So the lower the vitamin D level, the more severe the infection in patients. So we are recommending that you get your vitamin D level up, have your doctor check your vitamin D level, and the recommended maintenance dose is 5 to 10,000 IUs per day. Vitamin C is another very important nutrient that you need to have on board, and the recommendation for that is 1 to 3 grams per day. Zinc is another element that's been included in many of the early treatment protocols, and we recommend that you actually take zinc on a daily basis. 50 milligrams per day is the recommendation for the zinc. And you have to remain hydrated with lots of water. It's recommended that you drink 1 ounce of water for every, 2 ounces of water. No, half your body weight in water every day. I get that confused. So if you weigh 120 pounds, you want to drink 60 ounces of water a day. So all of those things are very important. And the walking is the most effective form of exercise that you can do. So walking on a daily basis, exercise, good nutrition, and sleeping at least 7 to 8 hours per night.
That is very good. Thank you, Dr. Sherrod. Dr. Daly-Garn, do you have any comments on nutrition?
So I don't have much to add to what has already been mentioned. It's just really important that you have a good balanced diet because your immune system doesn't work well if you don't have a good balanced diet. So, we've talked about a lot of other things, but, the basis is that, if you have an immune system that's functioning well on the front end, then if you are unfortunate enough to end up encountering this virus, you're more likely to be able to fight it off. The other thought to keep in mind is that with the vaccine, if your immune system is functioning well, you're more likely to get a better response to the vaccine. So it's really important to make sure that you're doing the things to take care of yourself so that you can do what you need to do in the world.
Dr. Despain?
Yeah, I would have to agree with that wholeheartedly, more specifically with regards to vitamin D, especially because what's interesting about vitamin D, more specifically vitamin D2, is that the human body can naturally create it or produce it like whenever you're out in the sunlight, right? It's, conversion of the ultraviolet rays into, like the vitamin D. But the problem is that in our industrialized society, people don't go out into the sun as much. And then more specifically for the Black community, consider the fact that we, like Black is beautiful, and Black is beautiful means that we have more eumelanin. But one of the drawbacks of having more eumelanin is that, again, like our eumelanin like kind of acts to like repel. It's like a photoprotective biopolymer that prevents like the ultraviolet rays from getting to our skin. So we need to be out more often. Most Black Americans don't know that actually, is that our skin like helps protect us. Again, it's photoprotective, and that's actually why we tend to age so well, and then also why we ostensibly have reduced risk of skin cancers, but then at the same time, like it's like a double-edged sword, right? So we do need more vitamin D.
Dr. Pointer, if you're on, you presented a paper last week and you spoke about lowering the death rate of your community from COVID. And one of the factors, I believe, was nutrition that you provided by home delivery and contracting with minority companies to provide this food. And I know many of our people live in food desert, so to speak. I'm wondering if in 60 seconds or so, you comment on how food and nutrition plays a role in the programs that you run in Buffalo, New York.
Well, thank you, Dr. Maxey. It's good to be here again today. It is the most important thing that we do. We deliver to people in their homes, food, fresh fruits and vegetables, intentionally, green leafy vegetables, intentionally delivering high citric acid and high vitamin C fruits, not by accident, but by design. And then we provide people also with a regimen of legumes to discourage the intake of fleshy proteins. It's the most important thing that we're doing. I mean, aside from making sure that people can stay home and that they can get tested in their neighborhood, I think it's the most important thing we are doing, and it is the one thing that we have not spared expense. And thankfully, we work with Black Grocer. He actually is an urban farmer who's been able to help us do that. And we're delivering to about 700 families a week. It's critically important. It can't be overstated.
Well, thank you so much. Before we go to the chat box and Michelle, I want to recognize that we have Attorney Penn Neighbor on, who has a community project where she has taught churches to grow gardens. And we've had her before. We're going to ask her at some point to do that. And we also know that Dr. Rhonda Johnson has had programs in Pittsburgh that have to do with community support. But I'd like to go to our chat box, and we're going to come back and deal with nutrition on another program. Michelle, you had a question?
Sure, I'd love to share a Q&A for our listeners who don't have access to the chat room. So the comment and question are, because of availability problems, if you take a vaccine from one manufacturer for one dose, for the first dose, for instance, Moderna, is there a problem with taking the second dose from another manufacturer, for instance, Pfizer? Can that result in problems due to incompatibility issues? This can be an issue because they want to expand the number of first vaccinations without holding back any of the second dosages. If the first dosage's manufacturer's vaccine is not readily available for the second dose, then while waiting for more of that vaccine, the initial immunity will start to diminish. So the response from Dr. Garnes in the chat room was, no data yet for using a different vaccine for the second dose. However, the recommendation is to have both doses be from the same manufacturer. It's important to be careful, even while wearing gloves, not to touch your face. That happened to be tagged onto that response. But if Dr. Garnes wants, or anyone else wants to elaborate on that Q&A, feel free.
Dr. Garnes?
Yeah, I think it's just the point that your point is very well taken. And I think it's something that we're going to have to look into, especially as we're prioritizing giving first doses and not reserving those second doses. It's something that's going to need to be addressed. You know, I think even the consideration is because the technology is so similar between the Pfizer and the Moderna vaccines. But as we have other vaccines entering the arena, you know, there's going to be a lot less cross pollination that it's going to be acceptable there as you're using vaccines that function from a different perspective. So the recommendation for right now is if you get the Pfizer vaccine for dose 1, you get the Pfizer vaccine for dose 2, you get Moderna, you get Moderna. We'll see if we get additional information. I'm sure, you know, just because we're humans and therefore imperfect, that there's going to be some errors in some cases, and we'll see what happens.
And then just to you know, parlay off of what Dr. Garnes had said. So based off of what the two mRNA-based vaccine developers have stated, Pfizer has specifically said that they only know thus far that their vaccine is efficacious for 90 days. Again, like they still need to conduct more studies. Whereas Moderna most recently, like this past week, stated that we are confident that our vaccine will last for 1 year in terms of immunity if you get both doses. So again, it's all ongoing, but you know, just something to keep in mind. But you know, I owing to the fact that they're both leveraging the same mechanism of action, and in other words, they're working in the same way. You know, I would say that it's kind of you're getting to the same endpoint. It's just that there are differences that I have discussed in prior programs, namely that there's a difference in thermal stability, aka temperature sensitivity, between the Pfizer and Moderna vaccines, and that basically Moderna has been working on their liposomal platform technology for decades, and because of that, they have a more stable liposomal carrier that actually can be stored at minus 20 degrees Celsius, which comes out to, if I'm not mistaken, minus 4 degrees Fahrenheit. Whereas for the Pfizer vaccine, that has to be stored at minus 70 degrees Celsius, which translates, again, if I'm not mistaken, to minus 94 degrees Fahrenheit.
Thank you, Dr. Neighbor-Stevens.
Thank you. So I hope that we are hitting the points that need to be driven home. We are very concerned that the message is not getting through of how you can actually protect yourself. So we wanted today to emphasize those tried and true public health measures, the mask, the distancing, and the hygiene. If you have other questions, please feel free to put them in the chat box and we'll try to get them in. But we have come to the end of the questions that we had, for the most part, prepared. I'd like to give the panelists an opportunity to give last remarks, starting with Dr. Jordan.
Well, thank you. I congratulate you on this one. I think this was put together very well. And I think all the questions that should be asked were. The one thing I would emphasize is pregnant women in pregnancy is different. And I think we need to make sure that any woman who is pregnant see an OBGYN doctor and take the advice from there. I still feel that as in our community, we have too many people not going in to see a provider until late. And it just makes no sense. And that's a part of them having to do. But again, there's a parallel. We still see patients now with HIV coming in with full-blown AIDS. And you ask why. You're in Los Angeles. You have PrEP. There's no reason for anyone to be getting infected now. And in this county, anyone who needs PrEP can get it free, but we still see that. And I don't know if we want to call that just community laziness, what, but I think there's some things we have to hold people accountable. You know, this is a disease. I don't think anyone wants to see someone get COVID. If you do, I think you should walk by any of the hospitals to see this is real. And we've gone through some nutty times lately with the president who is leaving soon, thank God. And there are some people who can justify that or see what he's doing as being something other than just sheer quackery. But I think we have to get people to be more responsible, period. The difference I can say about AIDS now versus other, there really is no reason for anyone to get HIV now. There's medicine that you can take to prevent yourself from getting it. There's medicine you can take if you get it, so there's no reason to jump out the window. We can't say that yet for COVID. So we have to really try to get people to be responsible, take the medicine, get the vaccination, and do the things that we need to so we will have a better and long living life.
Thank you,
Thank
Dr.
you.
Jordan. Dr. Garnes, I see you nodding your head. What are your last thoughts?
I think the things that I would just want to part with are, one, that there are very few real contraindications to getting the current vaccines. And so the vast majority of the people, and particularly those that are at increased risk for having severe COVID, should strongly consider getting the vaccine. If you have questions, please address those questions with your care provider. But I would argue toward getting the vaccine as opposed to not getting it. And secondly is that we are in this together, whether we want to be or not. We are responsible for each other. We are our brothers and sisters keepers. And so getting the vaccine works towards taking care of each other, continuing to wear your mask, wash your hands, staying away from other people that you don't live with is the way that we're able to take care of each other right now. And that we are so blessed to live in a time where we have the top technology that we can still, in most cases, connect with each other, even in spite of taking those measures.
Thank you. And Dr. Despain?
Yeah, so I would like to first start off by like really emphasizing something that Dr. Garnes mentioned in her in one of the chat box comments, namely that one way that we can actually mobilize the Black community even further is maybe by doing mobile vaccination campaigns, just like literally treating this like this is a military endeavor. And you know, the reality is that the opponent is a virus trying to take over your body. And then the second thing is that I would like to use the rest of what little time I have to actually address a question that was given by a Miss Helen Davis. So she had asked if the fact that the virus is mutating so rapidly entails that we will have to get follow-on vaccinations. And to that, I would probably say yes, because again, in a prior program, I gave a talk on antigenic drift, which is basically those small point mutations that happen ever so often that eventually end up in creating a new strain of a virus. And I mean, I have been, focused on virology since I was a kid. I've always been obsessed with viruses, but I have not, we're in a time period now where we can see in real time, like viruses changing. We could not do that during the 1918 Spanish influenza. We can do that now, and that arms you with more knowledge of what is to come. And the reality is that even though we know that there is now a Brazilian / Japanese strain of the virus, there's a South African strain of the virus, and then there's a British strain of the virus that are now all, threatening to become, I guess, dominant variants in the population. There recently were 2 new American strains that were identified in Ohio. One of them actually being in Columbus, Ohio. So the reality is that we really need to leverage every tool at our disposal, whether it's detergents or whether it's social distancing or whether it's masks or whether it's vaccines. The reality is that Blacks are at a disproportionately high risk of infection and death if we get the virus, and it keeps mutating. So it's really incumbent on all of us to work together as one unified community to combat this illness. Thank you.
Thank you. Is it okay if I speak a moment?
Absolutely.
Dr. Despain is going to be one of our key contributors. We've asked him and several other of our medical advisory to take responsibility for producing our academic program for the Sunday meeting. And Dr. Despain has agreed to be the producer for next week's meeting. And I'm going to ask his permission to add to his cadre of people that he's bringing to the table, Dr. Keith Norris, who is currently a vice president of health equity at UCLA, but he also happens to be one of the world's experts on vitamin D. And he wants to bring, along with Dr. Despain, to the table that issue of how that can be protective in many cases. He especially knows about vitamin D because that is one of the main components that we need to treat dialysis patients and kidney transplant patients, because we know that vitamin D is activated by enzymatic action in the kidney. So if you can add him to that panel that you are putting together. And we have several other things planned through the whole first quarter. We'll be bringing you interesting and very relevant programming. I do want to put together something probably with some of the behavioral health people, mental health people. I do think that health is not only physical, medical, and nutritional, but I believe that health is part of safety. And I believe that not only do we have this coronavirus, but we have this issue of white racism. And to me, racism is not being prejudiced, but racism is when you have the power to activate and do something with your prejudice against somebody else. And we want to protect our community, and we want to talk about how these people get radicalized. We want to talk about how we can protect our old people and young people from not only health disparities, but being ill-treated. We've had physicians who've been in the hospital with COVID, who've been killed, so to speak. We're all at risk at various levels, and we need to not put our head into a hole about we need to protect ourselves. So I'm going to take the liberty of speaking to some of our mental health people, Dr. Walsh, Dr. Clark, and others, and some of our people who know about the defense industry, and some of our military people. We have several admirals that have joined us on our calls. I see one now. And I know that some of our people are also work with the various defense agencies, CIA and other groups. And we need to find out what we need to do to protect ourselves health-wise, all of our health, including the defense of not having our young men lynched, not having our ladies assaulted, and not falling victim to this crazy America that we all love. But we know there's a certain component of it that is not healthy for communities of color. So I want to deal with that. I don't know in what form, but we'll figure it out. If any other people are interested in helping put that together, let us know by mailing us at the Black Health Trust. Are there any final questions, Dr. Neighbor Stevens?
No, I think we are up to date on the questions. In addition to what you were just speaking to, we will, going in the future, have to deal with access issues. It is an evolving issue, obviously, from the news that was shared this week. And I want to assure everyone that it is on our radar for a point of discussion in the future. The chairman of our task force is very concerned about this issue, Dr. Walks, and we will be coming back to our audience with programming around access issues.
I figured anybody who can take care of the health of Chocolate City must be good. We're going to need him to help us put all this together. Michelle Simmons, we thank you so much for your astuteness of being our hostess. I thank
My pleasure.
Dr. Neighbor Stevens. And as we close, is Miss Brenda Lee Ager on? then let me just say this. This program is agnostic to the degree that all of us may have our own faith or no faith at all. And we don't want to make this a religious program, but we do believe that spiritual and mental health is part of the solution of getting through a crisis. And it took care of having our forefathers being able to survive the vicissitudes, and I can actually spell that word, of slavery. It took a certain amount of faith to do that. So even though we're not a faith organization, it is not based upon that, I'm going to take a personal prerogative of what I have to get through. And I'm going to ask for the one pastor I recognize on the call right now to give us a very brief benediction and give thanks for us being able to bring this information to communities of color. Dr. Pointer. Are you able to unmute, sir?
Okay, I'm able to unmute. May the Lord bless you and keep you. May the Lord lift his countenance towards you. May the Lord set his face upon you and grant you peace. Amen.
Amen.
Thank you. Have a good day, everybody. Simon?
Take care, everyone. Thank you to all our panelists and guests today.
Bye.